if someone was listening to our conversation and watching us talk, and what is the big difference between an individual like Dr. Gregory or your average practitioner? But if you drew a line in the sand, how could he do this? And the other people, specialists, couldn't identify that you had allergic to coffee or whatever was, all these different things. And you've worked with him for over 5 years, on and off, just kind of keeping tweaked and tuned, but which is your choice, I guess, to do that. But what do you tell somebody about that? I mean, how do you explain that?
I think because his system is holistic.
Okay.
So if I go to an endocrinologist, they're simply looking at, do you have diabetes? Okay. No. Okay, goodbye. Right? But he's looking at a more holistic you, the entire
and everything
you, and everything
how
about
you work together.
How your stress level, what you do for a living, you know, your background, your childhood, how you grew up, who you grew up with, your educational background, where you currently live. He looks at everything about you with even with medical doctors when they ask you for past history. Right. Somehow that past history doesn't get calculated into the equation, right? It's just, oh, okay, so your mother had heart disease, your father had. But for Dr. Gregory, everything is very individualistic and very targeted to the person he's working with. Right. And also targeted to, I don't know, it's something he calls your vibrational level. Right. Right?
Because we're all energy.
We're all energy, and we're all different, very different, regardless of how we might think we're very similar.
Yeah, like even if you had a twin sister.
Right. Well, I did have a twin sister, but she's deceased. But if she had done it, we would have been totally different because we are different individuals and have different levels of who we are. So I think that would be Dr. Gregory, I don't say he would replace a medical doctor, medical in the sense of, you know, he's not going to write you a prescription, but he can certainly get you further down the road than your typical medical doctor.
Would you say that he can, with his tools and experience and expertise, evaluate you better?
Far better.
Far better.
Far better.
So he can look at you as a whole person.
Yes. In fact, I can take everything he tells me to a medical doctor and say, here's how it's like, I can give you a really good example. Like my father is a mechanic, a car mechanic. Right. So if something happens to my car, but he's 89. If something happens to my car, he tells me what it is, and I take that to the mechanic and say, this is what I want you to work on. Good. Right.
So you could do the same. Dr. Gregory's
with
information
Dr. Gregory,
could be taken somewhere else.
Take it somewhere else. If he says, now you need a prescription for this, you may need a prescription for this.
Okay.
I can take what he tells me to a medical doctor and say, I need an antibiotic.
So they'll verify it and give you the script.
Right. But I wouldn't just take a medical doctor's word for what I need. I would tell you that. I would never do that again.
Would you trust Dr. Gregory's information first?
Absolutely. That's what I'm saying. I would trust his information first. And if a medical doctor said to me, you are diabetic, I would go to Dr. Gregory and say, please check and make sure this is correct.
This is correct. That's very powerful.
I would do that. I wouldn't. I just would do that.
Right. Now.